I am James Randall Hansbrough. I'm a senior physician at Graves Gilbert Clinic in the pulmonary and sleep medicine division. A pulmonologist is especially above an internal medicine doctor. It usually takes 2 to 3 years of what's called subspecialty training. You specialize in diseases of the lungs. We do a wide variety of diseases. Our main emphasis is on asthma, COPD, which includes chronic bronchitis and emphysema, some unusual diseases of the lungs, infections of the lungs, including chronic infections like TB, histoplasmosis, and also acute infections where people either are hospitalized or develop an acute problem that needs immediate attention. COPD stands for Chronic Obstructive Pulmonary Disease. It includes several different diseases, but for the most part, it's chronic bronchitis and emphysema. The majority of people that get those diseases are smokers. There's a small percentage of people that get it from occupational exposure. It's a disease of the tubes that carry air in and out of the lungs. You have a windpipe that divides up into smaller and smaller tubes that carry air in and out of your lungs. Because of chronic irritation from either smoking or other insults, those tubes get diseased, usually swollen, narrowed. Sometimes they get where they tend to close down rapidly, and they lead to a variety of symptoms, varying from just a chronic cough to problems doing physical activity, to problems doing, just activities of daily living. They also can lead to a lot of sputum production, increased risk of infections, and they can vary anything from just a mild nagging cough to really limitations of what you can physically do to pronounced disability where you can do very little. Somebody comes in and says, I cough, get short of breath, I can't go upstairs anymore. A way to categorize it and be more specific is to do breathing tests or pulmonary functions where we actually measure what the capacity of your lung is to carry out various mechanical tests, and we could tell you how bad or how good your lungs are. Number one is remove any factors that are causing it. Try to get people to quit smoking, which is hard to do. If they're in some environment that we can modify, try to get some type of respiratory protection, try to vent the area, or just try to remove it. Taking care of yourself, early presentation to healthcare providers if you're sick with a respiratory illness is important. And then there are pharmacological or drugs that we can give people, ranging from inhalers that are used every once in a while just to open up the airways, to chronic inhalers that people take on a daily or sometimes 2 or 3 times a day to keep the airways open, but also to try to reduce the inflammation in the lungs, in the airways, to prevent the chronic symptoms. Being prepared for a visit and knowing what you want, knowing what questions to answer, and thinking, okay, what medical history is important for me to tell them? And that helps. Make sure you get vaccines and general healthcare workup. Especially for somebody that's relatively healthy and asymptomatic, it's not very onerous to see a doctor every year or two, and get vaccinations, healthcare screenings, attention to other medical issues they may have.